Hello, this is Dr. Wells from Wells Medicine, and I wanted to talk a little bit about my background today and how I ended up doing Wells Medicine and interventional mental health. So in college, I knew I wanted to study psychology and biology and go into medical school. And I did work in a rodent lab studying white rats and the effects of propranolol on memory and learning after a shock treatment. And whether or not we could reverse this learning through the use of beta blockers, namely propranolol, for decreasing basically the symptoms of PTSD in rats. And that study really set off a lot of interest and passion for learning about psychology and thinking about psychiatry in medical school. When I started medical school, one of the first clinical rotations I was able to do was psychiatry, and it was really discouraging because the medicines didn't seem like they were as effective as I would like them to be. And the whole process seemed very slow. A patient would come in and they would be just in absolute desperate need of some help, and we would give them a medication, and then they would come back and we would change the medication dose, and then they would come back and we would add another medication, and the whole time the patient was really struggling, and it felt like what I was able to offer was just medication changes in very brief insurance 15-minute office visits. Pretty quickly I decided that didn't fit my personality. And I discovered anesthesia, which when you give a patient a medication, you see the effect of the medication almost instantly. The entire point of anesthesiology is to facilitate surgeons getting the patients better within that episode of anesthesia. So we do whatever it takes to care for the patient in the entirety during that episode of anesthesia to allow the patients to get better through the surgery. And that really fit my personality. So I did my anesthesiology residency, and when I finished, the anesthesia group that I was working with was doing anesthesia for electric shock therapy with some of the psychiatrists from the Menninger Clinic. And through getting to know some of those docs, and through starting to see some of the literature about ketamine trickle into the anesthesia journals, and conversations that I was having with some of the psychiatrists from Baylor College of Medicine about the benefits of ketamine and their research with ketamine, everything sort of came together that they were doing research studies on ketamine in Houston, but they didn't have a place to send the patients who had done well with ketamine. They were actually sending them to one of the only clinics in the country at that time that was out of New York. And in talking with the doctors at Menninger and the doctors at Baylor, we realized that there was a need for a clinic in Houston. And so my husband and I set up the first ketamine clinic in Houston, and we were actually one of the first in the state of Texas. A clinic in San Antonio beat us by 6 months. And we were one of the first, I think, 12 or 13 clinics in the whole country. This was back in 2015. So we set up the clinic in Houston, and that was welcoming patients out of the Baylor studies. We welcomed patients from the UT Houston Department of Psychiatry. UTMB would send us patients. And so we've continued to work with clinician scientists from both Baylor and UTMB in various studies that we've published acabstracts and journal articles from the data from our clinic over the years. We've also worked with clinicians from Menninger Clinic and from UT Houston both on their patients that they send us and on study sites with them. And we just continue to grow and expand our offerings as new things become available. We try to stay on the cutting edge of interventional mental health. Our whole office is super passionate about what we're able to offer patients, and that's just reinforced every day by the results that we see from our patients over the years and from emails and reviews and phone calls that we get from friends and family of the patients and from patients themselves.